You're watching iWITNESS, the Print's COVID live feature covering the coronavirus pandemic. We have reporters on the ground across the country, and today I'm joined with Revathi, Krishnan, and Manisha Mondal right here in Delhi. You can see a little bit of the Gurudwara Rakabganj at the back. This Revathi is on the left of your screen. Manisha is on the right with the glasses. Both of you, welcome to iWITNESS, and tell me exactly. I know you're at Rakabganj, but why are you there and what's the situation? Why is Rakabganj Gurudwara so special today?
So Rakabganj is, over here it's a special day today because a 400 bed facility has been inaugurated and there are already patients streaming in. It's about 4:30, so at 2 o'clock they ask people to start coming in. There are 400 beds. Each bed has about 2 oxygen concentrators. The medicines also being provided. Rakabganj is also right near LNJP. So the entire purpose of this specialty, 400 bed facility to be inaugurated is to ease the load of LNJP. The people
So
here,
LNJP, Revathi, sorry to interrupt you. So LNJP Hospital is perhaps Delhi's largest COVID center. Is that correct? How many beds does it have?
It has around 1,500 beds.
Okay.
And over here at Rakabganj, right now, the patients who are not very critical are being called, like patients who have O2 level 85 or above it are being admitted here right now.
Okay. And you said that that patients are already streaming into the Gurudwara?
Yes, we have been here from I think around from 1:30, and patients started coming in around from 2:30, and the cars have been coming on, like they have been coming in, and also ambulances are also been coming in. But patients who are critical or who their oxygen levels are decreasing, they have been sent again to the hospital.
And Rakabganj here has 15 ambulances. So to ease again, to let's say help people come here. 85, it doesn't sound that critical, but over here there are people who, they're pressing their chest, they're trying to get air to breathe. So it's to ease the load. And we actually, since post 2:30, people coming to get admitted haven't stopped coming in. This is a walk-in facility, so you can walk in. The person who is a chairperson here said that all the official documentation can be done later by the family, but our main aim is to get them there. So walk-ins, referrals, everything is being allowed right now, and that's what we're seeing about 2 hours into people coming in. It's just not stopping.
Okay, so viewers, do send in your questions. Revathi and Manisha will answer them as best as they can. So tell me, both of you, is it that they have created a new structure? Is it like a new hospital? Or is it that the premises of the Gurudwara where devotees come and pray, are those spaces, have those been converted?
So those spaces have been converted. A side part of the Rakabganj Gurudwara is part of the Delhi Gurudwara Management Committee. So it's an extension of that where they've...
and it's the area where langar used to be served, which has been turned into like the COVID facility. And they have got new beds, new fans, like table fans, then oxygen concentrators, and each bed has its own desk. And as well as they have also provided whatever needs the patients have, they are providing everything in possible.
And the people here, I think, to also explain why a Rakabganj, a facility within like a religious, area would be different, is they're saying to, besides just taking care of the physical needs of the people, we want to make sure that mentally also they're okay, because we've been seeing many people getting hassled, the family. So they're saying they're going to do Gurbani also, where they can hear it so that, to help the patients. So it's completely air conditioned. There's a doctor's hospital, which is hostel right near the facility, or donning on and off area for the health workers, nurse staff, and doctors.
And special attention have been given to the food, the meals of the patients. As per the Gurudwara Sikh community members, they will give food like whatever the doctor prescribes, and especially fruits. 4 kind of foods are also being served to the patients here.
Okay. So, what is interesting, Revathi and Manisha, is that the Sikhs all over the country, and especially we've seen in Delhi, how they have in the spirit of service that we have, the Sikh community, and I'm sure all communities do that. But I think it's remarkable that the Sikh community has come out, and we saw, for example, just on the outskirts of Delhi in the Indirapuram Gurudwara, how that they had an oxygen langar. So talk to me a little bit about this community, the spirit that they have of sacrifice, of selflessness, of service.
So this is like, it's not now, it hasn't started this year. Last year when pandemic hit India, the Gurudwara Sikh committee have been working since then. We have also done a story that how Bangla Sahib was preparing meals for people during the lockdowns, and it has been distributing food across Delhi. And and that time also, like right now, apart from the langar, oxygen langar at Indirapuram, there is also oxygen langar near GK. And like, I think it has always been that this committee whenever a crisis hits the country, this comes like in full spirit to help, and they always have this thing ki hame to seva karni hai logo ki. Or
and actually, it's quite interesting you spoke about the Sikh community, because this year also marks the 400th birth anniversary of Guru Tegh Bahadur, Sikh Guru. So in commemoration of that, have they inaugurated a 400-bed facility. They said we didn't feel like celebrating this year. And when they did, they thought this was the most apt way of doing so, through service and of helping, let's say, a city like Delhi, which has been ravaged so badly by the second wave of COVID. And they also, like, there were also elections to the Delhi Sikh Gurudwara Committee, which was suspended. So they said that can be done later. So I think, I mean, it's their way also of commemorating a Sikh Guru who, I mean, their way of sacrifices, follow through the years.
Yeah.
It's nothing new, as she said. And this is, let's say, this is a manifestation example of it.
I think this word that you used, Manisha, the seva, which you see everywhere, and the sort of spirit of community service. But tell me a little bit more about this langar space that has been converted. So you said there are 400 beds. So does every bed have an oxygen cylinder? And explain to me a little bit. Just describe the scene to me a bit.
So there's a gate which enters. There's an orange zone where, let's say, the first rung where all the family can come in. There's a red zone where you're tested for your O2 levels. And then you can then enter, which is only for patients. And then let's say one family member who does the formalities. And then as you enter, it's this big hall. So one can imagine how people would sit in hordes in getting langar. But now that's been converted into multiple beds with 2 oxygen concentrators for about 10 ml.
7 liters and I think 10 liters.
Yeah, 7 per each bed. It's completely air conditioned, and then there's a partition with, I think, each 50 beds or so. So there are about 4 partitions
for men and women.
for men and
And
that was my next question, is that are there women there as well?
Yes.
They said so. I came here last week as well to see the preparations. And that time, the person whom I spoke to, he was very adamant that, ma'am, there will be, we have given special attention to like privacy, and we have to also think about the security of women and kids. And hence we have made a different area for them so that, they can feel secure within the premises of like a COVID center.
And so often, do you believe that these 400 beds will be taken up very soon? What do you think?
I mean, that it's tough to say. So like today we've seen at least about 50 patients already. Let's say in about 2 hours. There are many people whose actually oxygen levels were less than 85 and they still wanted to get admitted. So they're trying to increase it so that they can. I think it won't take too long, considering, like, let's say Delhi has a positivity rate of more than 2,300. 23%. I'm so sorry.
Yeah.
And about 300 deaths a day we're seeing. So I wouldn't be surprised if it gets filled up fast. It's already been about, let's say, 30 to 50 people have already been have come here to get admitted.
So is this free, Revathi and Manisha, or do you need to pay?
Completely free. It's absolutely free.
Okay. And obviously there are doctors on call and these people are sort of treating the patients. So talk to me a little bit about that. Did you speak to any of the doctors?
So many of the nursing staff is from it's like they're from different hospitals. Some are from LNJP. Some have been provided by the Delhi government. So this is in coordination with them. Mr. Satinder Jain, who's the health minister, even tweeted about saying he was looking at the preparations. There is so there's nursing staff from another super specialty hospital. So I think they were all as before the patients came up, before the official opening took place. They were all waiting. There's a dawning area, as I mentioned earlier, which is, in a garden or a lawn outside of the 400-bed facility. So there's a dawning on and off area there. They were like wearing the PPE kits and preparing themselves for patients to come in. And once they have come in, I don't think they've gotten a break now, and I doubt they're going to get one anytime soon.
So there's a question that's come in. Kumar is asking, how are the Gurudwaras managing expenses? Are they spending the money that they have already, in terms of in their corpus, or are they putting their own money, or is it that people are donating? How is it?
So it's a hybrid model. Actually, someone like Amitabh Bachchan is also contributed 2 crores to this 400-bed facility. It's in coordination. I think a bit of it is being managed by the Delhi government. It's the Gurudwara committee itself, the Rakabganj Gurudwara committee itself is, putting in a lot of their resources for this facility. There are other, let's say, eminent members. I think Mr. Rohit Shetty also, who's a film personality, is also wanted to contribute. So it's a hybrid model.
He wanted to contribute, or he has contributed?
He has expressed his desire to contribute from what...
Rohit Shetty is contributing to the Rakabganj Gurudwara?
Yes.
I see. And Amitabh Bachchan has given 2 crores. That's it?
Yes.
So these are the only 2 film actors who have given or have sort of donated something so far.
Yes.
We don't know about the others yet.
Nothing as of nothing as yet. So most of it is being managed by the Gurudwara committee.
Right. So what about, Juhi is asking, are they also getting foreign funding? For example, are they allowed to get foreign funding?
Under FCR, I'm not sure how, under FCRA. We're not sure how that works, because right now they said, the IHRO is on board with this, the International Human Rights Organization. Their medical staff is helping them out. But as of now, no foreign funding is being disclosed, is being put in here.
So did they talk, the authorities that you met from the Gurudwara, did they talk about, for example, the expenses on a daily basis? How much would they spend? Are they talking about things like that right now?
I don't think they can anticipate that as of now, because the patient intake right now, they don't know. They don't know how soon it will get filled. A lot of the medicines and the oxygen concentrators, as I mentioned, the oxygen concentrators are bought through their own funds and the medicines. Now, in terms of upkeep and the food and the number of patients, I think that will vary, or they'll start getting to know that in a few days. So in terms of the overall expenses as of now, I think it'd be too soon to say right now.
Okay. And if the 2 of you can talk to me a little bit, there's another question that's just come in. So Naveen is asking, how are the Gurudwara sevaks and the nurses, how are they ensuring their own safety? I assume they're wearing PPE kits. But Manisha, you said you had come here last year as well, when both Bangla Sahib and Rakabganj had ramped up their langar, for example, and they were, making 4,000 rotis a day. I remember you did that story. And then they were distributing them all around the city. So they're obviously familiar with COVID, but do they have PPE kits and masks and N95 masks? Are they prepared also to protect themselves?
So, in the afternoon, when I was walking inside, the security guards were wearing cloth masks, but the Gurudwara committee members and rushed in and they said that, you have to take care of yourself and wear an N95, because it's a COVID area. There will be COVID patients coming in. And over here,
how does he get an N95? I mean, who is going to give?
They are arranging. They have N95s for everyone, and they were actually distributing it to their staff members, who are basically standing like between the red zone and the orange zone, or the red zone, or like between the areas. So they are distributing them N95s. And for the nurses, I think the nurses here, the sevaks are not allowed after one point here. The hospital staff, like the COVID staff, is different, and the sevaks are different. So they would be supplying food and everything, but they said that they will be wearing PPE kits when the facility is like right now it has started, and everyone here over here is wearing the PP kits.
And since people have been coming in, like we're not, earlier we were allowed to enter and see the entire facility, but as patients have been coming in, we're not even around at the red zone, we're all standing behind in the orange zone.
I
So that's
see.
where we're speaking to you from.
And Revathi, did you see any women? I know you said that that there is a partition and women patients are going to be behind that. But did you see any women coming in?
Many women have been coming in. Two people who we spoke, their families we spoke to, both of them were women. One had COVID for about 2 weeks, and her oxygen levels were like consistently at about 85, and then hitting 88. And then he said, most of the consultations are happening via a teleconsultation. So here I want to come here because there's a doctor in the facility. I can see, she'd be having an oxygen concentrator too at her bedside. Another person was having difficulty breathing. She came with her husband and her child. So we're actually seeing many women. There was someone else who's also getting her formalities done.
What about the child? Does the child stay with her, or does the child go back home with the father?
So I think that's what we were asking them, like, is she going to be here overnight? And I think right now the family is they were in such a, because they were trying every place. So, I asked them, what is your plan for the night? And they said, we don't know. We're going on an hour-to-hour basis. So they're also hopeful that they may be able to take her home at night. But I think they've actually gone to get her a blanket because she was feeling a bit cold. So I think they haven't planned till now for the night. No space for the family to stay in that facility.
But what about the child? For example, if there's a young child, can the mother keep the young child with her?
I don't think like it's anywhere allowed, like in the COVID facilities. If the kid is small and that person is COVID negative, that person is kept like not near their mothers. It's risky for them as well.
And we haven't seen any, there was a partition for women and children. So, I also depends on how small the child is, I guess.
Sure, absolutely. But, I have a question, is that when both of you have been, sort of walking, traveling, covering the city, reporting the city and reporting the COVID crisis in the city. Now, there are, for example, outside LNJP, which is the Lok Nayak Jayaprakash Hospital, which is Delhi's biggest COVID center, as you said, Manisha, with 1,500 beds. Opposite that, I believe that there is a banquet hall. Now, I'm sure that there is, basically large spaces that have been taken over and converted into COVID centers. For example, at the Commonwealth Games Village, that could be another one. But I'm just wondering if you can compare, if either of you have been to any of the other spaces, and if you can compare this Gurudwara space with any of the others.
I have been to the Commonwealth Village. I have been to the Commonwealth Village area.
Okay.
Yeah. Am I audible?
Now go ahead. Yes, Manisha, I can hear you. Go ahead.
Yeah, so I have been to the Commonwealth Village area, but over there, the facility is actually very good over there. But like Rakabganj, over there also, there is a oxygen limit till which patients are being accepted. Not if the oxygen level, I think it's below 85, they are also not accepting the critical patients. But I think there is no difference between these facilities. They are clean and even I have gone to Shehnai, and all the three facilities are clean. They're providing proper meals, and there are doctors who are looking after patients. And this facility has started today only. So let's see. And
I think if you have to compare it, can you hear us?
Yes, I can hear you, Revathi. Go ahead.
I think if you have to compare, it would probably be city to city or state to state instead of within here, because I also recently went to Madhya Pradesh, and over there, the Radhaswamy Satsang Vyas set up another facility there, but there were no oxygen beds. So that is one of the comparisons. I think a better comparison would probably be state to state for such facility. From what I gather from what my colleagues have reported.
Right, that's a good point. So if you can tell me a little bit about Delhi today. You said that over the weekend, things have got, every day, I think India breaks its own global record, but Delhi also breaks its own record on a daily basis. Is the positivity rate coming down, which means that our active infections, are they coming down? Is death rates coming down? What can you tell me a little bit, the two of you?
So the positivity rate, I mean, is looming around 23%, and it may be up and down. What's actually significantly coming down, which has been noticed by lots of people looking at the bulletin, is the number of tests. There's a testing which is being done. So, I mean, that would be a cause of concern. I think as of now, I mean,
coming down. Is that what you're saying?
Yes, yes. Number of tests. Yeah. So, I mean, if I'm not wrong, I mean, it's come down a significant amount. So,
so when Delhi was recording around like 20,000 or 25,000 cases, they were testing almost like 1 lakh per day. Right now, they're testing around
below 80,000.
Below 80,000, like around 75,000, and the cases have also come down. Like I think yesterday it was like around 17,000 cases Delhi reported.
Yeah.
So
I think this is also the weekend lag, because perhaps on the weekend, you know, when people test less, and we'll perhaps know in the next 24 hours whether the positivity rate has actually come down or the testing will go up again. But you do feel in your experience that the testing has come down. And why is that? Why is the testing down?
I mean, I'm not. I mean, one. I mean, I don't know if I can. I'm equipped to explain or understand why per se the testing has come down as of now.
Okay. Manisha, do you know what? I mean, could you sort of?
Sorry, could you repeat that again, please?
Yeah, I think there's some disturbance in the back. I was just asking Manisha if you had a view on why you think testing has come down. Is it just that people are fatigued? Are they not going and getting themselves tested? Are there not enough tests in the market or in the lab? Why do you think?
Jyoti, I was COVID positive like 2 weeks ago, and to get my negative report, I had to like talk to a lot of people to get tested. They are swamped with like so many samples they have taken like 1 week ago that they can't even test. Like they are not conducting tests right now. So I think there can be one of the reasons that because there are so many samples and they are lagging behind.
And a large part is also government testing within itself in certain areas, you know, huge clusters. So, I mean, if you're asking why has it come down on that end, that could also be a possible reason.
Yeah. So one last question before I let you both go. What's happening with the vaccination drive in Delhi?
Vaccination drive.
So, I mean, I think...
First of all, have you both got yourselves vaccinated?
So, I've got my first shot exactly a week back.
For me, I recovered from COVID like a week ago. So, it's like I'll get vaccinated after a month.
Right.
She's going to be donating her plasma first.
Oh, you are donating. That's great, Manisha, to hear. But, you know, one of the reasons why the vaccination drive is supposed to be faltering is because it seems like Delhi is running out of vaccines. So I don't know if you're hearing that. Are people talking about that in the Gurudwara? What are people saying?
So vaccination isn't much of a focus here at the Gurudwara. I think it's more COVID management and COVID treatment. Supply has been an issue. I think it's been, with the Delhi government, it's been reported for a while now where they're running out of vials. Supply has been an issue not only, with multiple states. So there is, so I think it's more of a supply issue and, meeting that with the demand vis-a-vis any vaccine hesitancy, at least in Delhi.
Right, girls, I'm going to let you both go. Thank you for your time, for explaining what's going on, not just in Delhi, but especially at the Rakabganj Gurudwara. And we would encourage all those who are mildly positive or infected, and like both Revathi and Manisha said, if your SpO2 level, that's your oxygen level, is above 85. So if you're below 85, you should go to a hospital. If you have mild infection, then you could go to the Rakabganj Gurudwara. Thank you so much again, and we will follow your reporting across the city. And viewers, thank you so much for watching. This is iWITNESS from ThePrint.